My name is Dr. Rashmi Halker Singh, and I'm the Deputy Editor of Headache. I'm joined today by Dr. Antonia Russo, who's one of the authors of a recent publication called Infodemiology of Cluster Headache Seasonality, a proof of concept by Google Trends Analysis. Welcome, Dr. Russo.
Hi, thank
So,
you for having me.
yes, we're so excited to have you with us today. So I was very interested in your study. I think cluster headache is a really important topic that definitely needs more research. And I was wondering if you could first of all tell us a little bit about this research.
Yeah, starting from scratch, we know that patients with headache frequently use search engines such as Google, looking for terms related to their headaches or their symptoms. These researchers create data that could be analyzed by Google Trends. On the other hand, Google Trends has been already demonstrated as a useful tool for surveillance studies, for example, providing infodemiology insight by indirect estimation of disease outbreaks, for instance, or burden of disease. So based on the fact that cluster headache is characterized by an annual patterns with peaks during spring and fall, although with some conflicting results about that, our cross-sectional studies aim to investigate, by Google Trends, the seasonality of search volume for the term cluster headache, focusing on the last 10 years. And we first translated the term cluster headache into the 10 most spoken language in the world. And then we checked it out on Google Trends in order to compare variation of search volumes across different periods of the time. And countries were grouped in the relation of a hemisphere, I mean, northern and southern hemisphere, and search volume in the meteorological seasons subgroups, I mean, summer and winter versus spring and fall.
Great. So what did you find from all of this work? What were your results?
We found a seasonal trend for the term cluster headache and related translation in the most spoken language worldwide. Specifically, we observe a significantly higher search volume during spring and fall compared to summer and winter, interestingly, in both the hemispheres. For all the simplicity of this finding, our data make a point in a still debated topic, that is the seasonality of cluster headache. And we hope that it would be useful for clinicians to consider seasonality of cluster headache when they make diagnosis of cluster headache in their patients.
So it sounds like the study supported our thoughts that there is a seasonality to cluster headache. Were you surprised by anything you found at all, or this was pretty much a straightforward result?
We are not surprised about this topic, although there are conflicting results about that. On the other hand, temporal predictability and the periodicity of cluster headache, that are the main reason for the name of the disease, suggest that the underlying pathophysiological mechanism is most likely rooted in hypothalamus dysfunction and the related effects through the connection of hypothalamus with trigeminal-vascular, trigeminal-cervical, and trigeminal-autonomic structures, along with the dysfunctional nociceptive system. And so our findings supporting the importance of seasonality could also suggest the application of seasonality besides the International Headache Society criteria for cluster headache, of course, the application of seasonality as ancillary criteria for the diagnosis of cluster headache, perhaps.
That's a very interesting thought. I think this is
Yeah.
really interesting also because we always think about, well, actually, I mean, more recently, we're thinking about using artificial intelligence or things like that, or including patient input into our research. And this is a very novel concept of looking at Google Trends to better understand cluster headache. So I think that's a fascinating idea. Um, is there anything else you want to share with our viewers?
Yeah, there are two uh, points I would like to point out, if possible. The first is related to cluster headache, that unfortunately, despite so distinctive phenotype, is still burdened by diagnostic delay. This is a very important point. And I think that cluster headache should be instantly recognized due to the dramatic nature of repetitive attacks characterized by severe pain, autonomic symptoms, as well as being increasingly recognized as a source of personal and socioeconomic burden. And the second point is related to the digital tools that are tremendously grown in the recent years. However, the use of digital tools in a large and complex research system is uh, rather limited. I believe that we should take advantages of a so great amount of data coming from different sources in order to improve our knowledge of different disease, considering the comprehensive view of patients' experience that could in turn improve, enrich our insight of different diseases, specifically on headaches.
Those are excellent points. I am also a clinician. I see adults who live with headache conditions, and I'm frequently making a new diagnosis of cluster headache. Not frequently, but given it's a rare condition, but frequently enough. And many of these individuals have lived with this for many years, and I might be the first one to give their symptoms a name. Or maybe they've been given a diagnosis of cluster headache, but no one suggested appropriate treatment. And as you mentioned, it's devastating to hear that, given the high burden of disease associated with cluster headache. And just like you explained, if people are looking at Google to find information, I think we as a headache medicine community should be utilizing that to better um, make available, education for patients as well. So that's really important. So, yes.
Yeah, I totally agree. I think that we should also improve this kind of information for patients and improve especially the readability of our information, because frequently our information are not easy to be understood by our patients, or alternatively patients could take information on websites that are not scientifically valid. And these are two different different parts of the same topic that we should take in consideration.
Absolutely. I agree completely with you. I think that's a really important point that you make. Well, thank you so much for speaking with me today. I think this is really important. I really appreciate our discussion and also the work you put out. So thank you so much.
Thank you so much. Thank you indeed.